Dan, are you ready? Well, good morning, everyone. It is 9 a.m. We will go ahead and
Recording
get started.
in progress.
A copy of the Open Meetings Act is located on the back wall of the legislative chambers, as well as an automatic external defibrillator. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. We will begin with the agenda for the Douglas County Board of Equalization. Roll call, please.
Commissioner Maureen Boyle.
Here.
Commissioner Mike Boyle is absent. Commissioner Kavanaugh. Here. Commissioner Friend. Here. Commissioner Morgan. Here. Commissioner Rogers. Here. Madam Chair.
Present. Item A, approval of the minutes of the Board of Equalization meeting held Tuesday, June 8th, 2021. And B, call for a meeting and set Tuesday, June 22nd, 2021, as a date for hearing on certified assessment corrections reflecting the addition of omitted property to the tax rolls or increased value on property. Is there a motion to approve A and B? Motion by Commissioner Rogers, seconded by Commissioner Morgan. Any questions or comments? Please vote.
Yes.
I think I heard you, Commissioner Maureen Boyle. You said yes?
Yes.
Okay, thank you. Motion passes 6-0. Commissioner Maureen Boyle voting virtually. All other commissioners are voting in person. In person.
Next is citizen comments. Anyone wishing to speak to the Board of Equalization about an item not on the agenda? Seeing none, we will move to resolutions. We have 3 items, D through F. Is there a motion to approve and adjourn? Motion by Commissioner Rogers, seconded by Commissioner Morgan. Any questions or comments? Please vote.
I vote yes.
Motion passes 6-0. Commissioner Maureen Boyle voting virtually. All other commissioners are voting in person.
We'll move to our agenda for the Douglas County Board of Corrections. Roll call, please.
Commissioner Maureen Boyle.
Here.
Commissioner Mike Boyle is absent. Commissioner Kavanaugh. Commissioner Friend. Here. Commissioner Morgan. Commissioner Rogers. Madam Chair.
Present. Item 1, approval of the minutes of the Board of Corrections meeting held Tuesday, May 11th, 2021. Motion by Commissioner Rogers, seconded by Commissioner Morgan. Any questions or comments? Please vote.
I vote yes.
Motion passes 6-0. Commissioner Maureen Boyle voting virtually. All other commissioners voting in person.
Item 2, citizen comments. Is there anyone wishing to speak to the Board of Corrections about an item not on the agenda?
Over the course of the pandemic for child.
Seeing none, we will move to the report from our Director of Corrections. Good morning, Mike.
Good morning. Good morning, Commissioners. You have before you my report for the month of May. I'll jump in to enclosure number 1, Administrative Services. Heading into our final month of the fiscal year. Heading into the final month of our fiscal year, our budget projection is $1,473,540 under budget. We will finish the year under budget, and we have identified obligations for fiscal year 22, which can be met with the anticipated savings we've achieved during fiscal year 21. $218,757 were spent on overtime costs in May. This is a decrease of approximately $55,000 from the previous month, and a decrease of approximately $210,000 from just 5 months before. Essentially, we have reduced overtime costs by nearly half during the previous several months. However, I do anticipate a bit of an increase over the summer months, as that becomes our high vacation time for our staff. And we have had a little spike in attrition lately, which I will speak a little bit more to later on in my report. Enclosure number 2, Community Corrections and Reentry Services. Due to the drastic impact of COVID-19 on community corrections activities, our data is significantly different than the norm. This, I hope, is one of the final months that I'm actually going to say that. Our work release, reentry assistance program, and the law library were all suspended during the month. However, individual requests for law library materials were addressed. I'm pleased to announce that the law library actually did open on June 7th. Virtual and in-person programming resumed to a limited extent in our therapeutic communities in May, with the bulk of programming slated to resume June 14th. We are preparing to fully reopen community corrections tentatively on July 12th, after the installation of the new security system has been completed in the Criminal Justice Center. I'm also pleased to tell you that over the course of the month of May, the 24/7 sobriety program transitioned to its pre-pandemic testing protocols with safety measures in place. We hope to realize a decrease in drug testing violations, particularly, with more rigorous and immediate methods of testing that we have not been able to utilize during the pandemic. The program continues to operate at or near all-time highs, with over 400 individuals currently on the program. There were 59 individuals placed on the program. There were 873 breath tests that were completed using remote breath technology, and that's the protocol that's being phased out, or has been phased out. 2,221 in-person breath tests were conducted in May. And there were 13 of those that were positive for alcohol use. There were 23 no-shows, and the overall breath testing compliance rate was 99.2%. 63 individuals were monitored for 1,490 days of SCRAM monitoring. And again, those are the bracelets that detect alcohol use through the skin. There were 0 no-shows, 0 tampering violations, and 0 alcohol violations. Conversely, the SCRAM compliance rate was 100%. There were 772 saliva drug tests administered with 81 violations. There were 64 drug testing patches that were submitted for testing with 14 violations. As I mentioned, work release was closed for the month. You'll hear me say that one more time at my next month's report, and then we'll be open for business during July. House arrest admitted 103 individuals. The Reentry Assistance Program, or RAP, was closed for the month. The therapeutic communities in the jail started to continue to increase programming. And as I said, a limited amount of programming provided by contracted providers resumed in May in a combination of both virtual and in-person formats. Pretrial services. We continue to provide regular information to the courts for candidates for bond reduction and early pleas in response to the pandemic. There were 95 bed days that were saved from 17 individuals being referred for priority prosecution. 282 individuals were placed on pretrial release. There were 1,400 individuals managed on pretrial release over the course of the month with a 93% compliance rate. As I mentioned before, the law library was closed but has since reopened. We continue to participate in a year-long pilot project to implement the public safety assessment as a part of our strategy to enhance our pretrial release supervision and supportive services. We're coming into kind of where the rubber meets the road on that project, where we're really developing our matrix of risk versus supervision to provide that resource for the judges as to what conditions to apply to individuals based on the risks that they present. And we are currently working on implementing a new pretrial case management software system, which will also play a key role in the overall enhancement of pretrial services and information sharing with the courts. Enclosure number 3, compliance. Our regular documentation is being collected for all compliance processes. Preparations for the NCCHC, which is the National Commission on Correctional Health Care. That audit, preparation for that audit is underway, and that audit will be conducted in mid-July. 10 officers below the rank of sergeant left employment in May. These departures include a retirement, accepting positions at law enforcement agencies, and other reasons. And I'll tell you, commissioners, I try to tell it pretty accurately and like it is. We have continued that trend of having more additional departures in the month of June. Won't look a whole lot better than the month of May. And we've started outreach to the staff to kind of see what is going, is there anything driving this in particular? There's a lot of different reasons. There are people that moved back to their home states. The job market is very friendly right now for job seekers. And this has been a tough couple of years to work in this profession. And I guess it shouldn't surprise me that when people have opportunities where they can make a good living in an environment that's less challenging and less stressful, that they might take that. What that does for myself and my staff is challenge us to not just accept that as the status quo and to get back to the focus that we had pre-pandemic on the health and wellness of our staff, the morale, providing them opportunities for cross-training and advancement. So we're kind of getting back to the basics again now that hopefully we don't have to think about the pandemic first and foremost dominating our day, each day going forward. A class of 17 officers began their training academy on June 1st. However, 3 of them separated employment within 2 days, leaving a class of 14 going forward. And I will say that phenomenon of the job market being very strong, we were expecting a class of 20 or more, and they called us, a week or 2 before, and job offers came in that they accepted rather than beginning their careers with us. And that also explains a couple of the departures that happened within the first week of training. So we are going to have to be very thoughtful and assertive in how we continue to address our staffing. As I said, we are refocusing our attention on staff retention and resiliency efforts, which were hampered during the course of the pandemic and the other challenge that we have faced over the past 18 months. Turning to enclosure number 5, our population. We had 1,347 admissions during May. That is a modest decrease. There were 1,310 releases. Our high count was 1,202. Our low count was 1,138. We had a small decrease in our average daily population, and we averaged 1,152 in custody. That might be my phone, I apologize. We had, there were 116 custodial sanctioned bed days in May. I do want to continue to applaud probation. We had seen that starting to spike back up. Our population was going up. I reached out to probation to ask for their assistance especially until we get the housing units that we're currently renovating the showers on back online, if they can work to manage people without using incarceration as a sanction and come up with other ways that they do so, and those numbers have gone back down. The U.S. Marshal population increased slightly. The ICE population remains stable. The felony pretrial population has increased. The misdemeanor pretrial population decreased. Probation violations remain stable. The female population increased, and we intermittently had to operate a 4th female housing unit throughout the month of May, depending on the population, as that population as the female population did increase. Enclosure number 6, medical, there were 1,139 intake screenings and 338 health and physical assessments. Inmates were sent out 21 times for emergent medical care. 3 of those were by 911. There were 9 hospital admissions, which resulted in 29 days combined hospitalization. Enclosure number 7, mental health. There were 138 initial psychiatric assessments. There were 88 initial mental health assessments. There were 55 mental health infirmary placements. There were 3 referrals to the Board of Mental Health, and 4 individuals were transferred to long-term psychiatric facilities. Other noteworthy items. As a department, we continue to respond to the COVID-19 pandemic. We are fortunate to report that we have had 0 positive COVID-19 cases among our staff or our incarcerated population for probably 2 to 3 months now, actually. Nearly 75% of our staff have been vaccinated, as of June 1st, we had vaccinated 747 incarcerated individuals, including 147 of them during the month of May. We continue to follow CDC and Douglas County Health Department guidance and advice during the pandemic regarding quarantine, testing, PPE use, and sanitation. And just to kind of summarize some of the plans that I had said that we're taking to resume some of our operations, we've developed the following plans to begin resumption of operations that were suspended during the pandemic. Programs, contractors, and volunteers will initially be required to provide proof of vaccination to provide in-person services at DCDC. On June 1st, limited in-person attorney visits were established for the review of discovery materials and other documents. On June 7th, the law library reopened with additional safety protocols. Yesterday, on June 14th, the bulk of our contracted programming resumed in the jail. On July 6th, a core group of volunteers, the ones that are in the jail almost every day for significant periods of time, will be allowed to resume in-person services. And on July 12th, work release in the reentry assistance program will reopen pending the successful installation of the security system by that date. Initially, for those programs in community corrections, we are going to require vaccination for placement in those programs. It is a higher risk environment. If we run those programs how they're intended, those folks engage the community, they go out to work, they go out to appointments, and we want, and their living space is more open. There's not individual rooms. It's kind of an open barracks style in community corrections. And what we've learned during the pandemic is that those environments are vulnerable to spread of the virus if the virus is present. So we're going to start with requiring vaccinations. Hopefully that will also provide a significant incentive for folks who are in the jail currently to get vaccinated so that they can be considered for community corrections. We are beginning that actual sort of awareness campaign for the incarcerated population right now, so that those who are present who might be eligible for community corrections can consider being vaccinated in time and be eligible for placement by the time we open in July. Contracted programming in community corrections will resume when a sufficient number of individuals have been transferred to work release and wrap. There is currently not a timetable for reopening opening the lobby to the public for public visitation. And the reason for that is more than just a COVID-related safety protocol. A lot of the processes we put in place would have basically, it would result in a ripple effect that we haven't quite figured out how to deal with yet. That meaning that if we reopen the lobby to the public, all attorney visits will have to move upstairs and be in person. Right now, we don't have the capacity for that because virtual court is happening in the same space as our attorney visit area. So we have to look at our allocation of space and plan for that so that we can operate virtual court, have 100% capacity for attorneys before we reopen the lobby to the public. Work to implement body-worn cameras, our new security system, and our tablet system continue. And as I mentioned earlier, a recommitment to staff development, wellness, and resiliency is underway. This was the primary focus during the first half of my tenure as director, and it dawned on me, commissioners, that I've been the director the duration of the pandemic is basically half my tenure as director. Was director for about 16 or 17 months when the world changed, and it's been about 16 or 17 months since it's changed. And it's time for us to get back and refocus on those goals we established when I first took over. In any rate, we welcome the opportunity to begin to focus on our future again, rather than predominantly being forced to only address the challenges of the present. So with that, I'm ready for your questions.
Thank you, Mike. Commissioner Kavanaugh, then Commissioner Mike Friend.
Thank you, and thank you for this. Kudos on getting through the pandemic in relatively good shape. I'm particularly encouraged by the fact that you're reporting 0 COVID positive cases with the staff and the population. That's a major accomplishment.
Thank you.
And I think a credit to your handling of the pandemic in a very closed population, which is extremely dangerous. So thank you for that. We have tracked in here, and you do a good job of it, a couple of things on pie graphs, and I would just point out stylistically, they're really hard to read because of the colors. We'll get to this in a second, but
Okay.
it might be better not to do pie graphs if the color combinations aren't available so that you can actually,
I see
Break
that
them out.
printed much darker than it typically does.
I'm trying to be helpful there.
Yep.
I see that the total admits to medical housing over the year is about 5,000. Was that impacted by COVID quite a bit? Were people getting sick and going to medical housing because of COVID, or was it just the regular?
Not for the most part. I mean, there was probably a slight uptick for that. I mean, we built a quarantine unit outside of our infirmary to deal with COVID.
That's fine, I
Yeah.
just wondered. The kind of prognosis, diagnosis in pages 40 to 45, in the sixth section of the report is good. It gives us a feel for the medical condition of our population there. The one thing it doesn't include, and this is something that is kind of recurrent, are fatalities. And I know because you do a good job of notifying us of the fatalities going forward, that we've recently suffered another fatality. It might be helpful because it's the most serious of
Absolutely.
conditions to include fatalities as well as the medical conditions that we include in the things. The graph there on 44 is one of the ones that I referred to, which is difficult to read in terms of diagnosis. And the overtime number that you reported, which is down, is very good. It's kind of seesaws with our staffing, though, and the 10 people that we've lost in the last month kind of argue the other way. Do we have a class coming on, did you say?
We currently have a class in training right now, 14 officers. And we currently have 2 more classes scheduled to be completed before the end of the year. We've have this elusive goal of being able to do quarterly classes so that we can invest more training in our current staff in between those classes rather than just doing back-to-back-to-back hiring. We're currently scheduled to have 5 classes in 2021. Our third one is ongoing, so we'll see how those numbers pan out and whether we need to try and squeeze in another class.
5 classes in 21 or 22?
In 21, with a goal of only having 4
Excellent.
next year.
On the population breakout, the ethnic population, this is another graph that's very difficult to read on page 36. But
1 minute.
if I could, just adding up the ones that I could read, which are the minority populations, the black population of 32.9%, Hispanic of 12.8%, Native American 3.08%, Asian 1.82%, and other 0.52%. I believe adds up to a 53.2% minority population in our corrections. Again, a minority majority population, right?
That's correct, Commissioner.
I can't read the Caucasian.
And my apologies. I don't know why this printed so much darker than what I saw it on my computer screen. But.
So this is ongoing. I mean, it seems like every single month we have a majority minority population locked up in our correction center. Is that about right?
It's been that way for a significant period of time.
Okay. And you have no control over that. You house whoever's brought to you by the public safety
Time.
law enforcement people. I realize that.
Thank you, Commissioner Kavanaugh. Commissioner Mike Friend.
Thank you, Madam Chair. Mike, again, thanks for the report. And I go through these, as you can imagine, I go through these pretty, I go through them at their depth, you know, every time you hand them out. And so they're not going unread. Commissioner Kavanaugh proved that too. He looks at them, and I think I can speak for all the commissioners. I think that's the case. So thank you for that. I think you learn a lot about. I think when you're working in government and working with people in general, I think you learn a lot about people when you get in meetings with them and try to solve problems. And I don't I'm not good, or I don't do it very often. I don't hand out superlatives on it, and I'm not going to do it in this forum very often. But I've learned a lot about you, and I've learned a little bit about your team based on a couple of problems that we've solved. And one of them, Commissioner Mike Boyle actually was alerted to it as well. It came to my attention a while back that the law enforcement community there were changes made in the intake process at corrections, and the law enforcement community had communicated that there could have been a disconnect, or there were some problems in that regard. I'm gonna save everybody the rap, but some knew it was a problem, some didn't. You grabbed it, your team grabbed it. I got with you, Director Myers. I got with Deputy Chief Scott Gray, and the process issues or disconnects, if you will, that were practically affecting public safety resources. You were very open to working through that stuff because you had been dealing with this for a long time. So I appreciate that. And I can tell you that I think I learned a lot about the way your organization operates, because this was the most efficient. I've only been here, 8 months, I guess. But it goes to my business background too. This was the most efficient problem-solving deal I ever have been involved in. And people don't think that it might have been that significant, but it was. So I wanted to thank you in public for that. We can drill down into it deeper with other folks if they're curious, but the problem is solved to the best of my knowledge. And I wanted you to know that we've gotten, nothing but praise for those discussions. So thank you very much. And thanks for the report again.
Thank you, Commissioner. I really just need to deflect all the credit to the people who do the work. I get to come up here and tell you about the good work that they do, but I do appreciate the acknowledgement that we worked hard to work this out.
Thank you, Commissioner Friend. Anyone else? Mike, when you said that we had to temporarily or for a short period of time open up the 4 units for the females, what was the increase reasons for female arrests? Do you know off the top of your head?
Commissioner, I wish I could answer that for you. It may just be associated with typically during these months we see more arrests in general, and that includes the female population. We had been fortunate for probably maybe for the duration of the pandemic for the most part to only operate 3 female housing units. Prior to that, the norm was 4. Right. And so we'll work hard to try and understand that and do what we can. It will also help when community corrections reopens, because some of those folks will be eligible for those programs, and we'll be able to free up some space in the jail.
Well, I know prior to the pandemic, assaults and drugs were the, I guess, top tier of reasons for female coming to our facility. I'm hoping that we can also get back to the women's task force that we had working
Absolutely.
on these issues to really drill down as to what we can do on the prevention, intervention side, diversion side before they get to the facility. But again, if there's anything unusual as to the reasons, if you get wind of that, I'd be appreciative to hear that.
We'll take a look at the data and see if there's anything that's stands out other than just the normal seasonal increases.
Okay, thank you. Commissioner Kavanaugh?
Following up on a little bit of that, we have been able to fully implement the upgrades on the space rehab from the public safety bond, right?
That's correct, and there were funds, we came in under budget and had some funds left, so now we are renovating, there's the newest construction of the jail in 2004, the showers are in need of attention. And so we have one of those units closed to do that right now. We had hoped to do 3. There's an expiration date on those funds. Everything COVID related in terms of supply chains, we may only be able to do 2 because we won't be able to get all of the components to the showers. But yes, to your question, all of the original scope of that project is done and open.
And we're very proud of the fact that you took this voter-approved bond issue, brought it in under budget and on time. Kudos to you. It seems to have come just at the right time because you were saddled with the COVID pandemic and had an up-to-date facility to deal with that. So I'm looking forward to going through it and seeing all the upgrades. But thank you for getting that done on time and under budget.
Again, Commissioners, Public Properties, so the contractors, my staff that worked with them, so much credit. There's a lot of people who deserve more credit than I do.
You're very good to say that. Thank you.
Any other questions or comments? All right, thank you, Mike.
Thank you.
Next, we will move, motion to adjourn is there a second? Motion by Commissioner Rogers, seconded by Commissioner Morgan. Please vote.
I vote yes.
Motion passes 6-0. Commissioner Marine Boyle voting virtually, other commissioners voting in person.
We'll move to the agenda for the Douglas County Board of Commissioners. Roll call, please.
Commissioner Marine Boyle.
Here.
Commissioner Mike Boyle is absent. Commissioner Kavanaugh. Commissioner Friend.
Here.
Commissioner Morgan. Commissioner Rogers. Madam Chair.
Present. Item A, approval of the minutes of the Board of Commissioners meeting held Tuesday, June 8th, 2021. Please note that the minutes from the pre-board meeting on Monday, June 7th, 2021 are available on the website. Item B, approval of the claims submitted for payment process through Tuesday, June 15, 2021. Is there a motion to approve A and B? Motion by Commissioner Morgan, seconded by Commissioner Rogers. Please, any questions or comments? Please vote.
I vote yes.
Motion passes 6-0. Commissioner Marine Boyle voting virtually, other commissioners voting in person.
We'll move to the consent agenda, items A through H. Is there a motion to approve? Any questions or comments? Motion by Commissioner Rogers, seconded by Commissioner Morgan. Please vote.
I vote yes.
Motion passes 6-0. Commissioner Marine Boyle voting virtually, other commissioners voting in person.
We'll move to recognition and proclamations. Item A, resolution recognizing and celebrating June 19, 2021 as Juneteenth, also called Emancipation Day, commemorating the end of slavery in the United States. And Commissioner Chris Rogers will read the resolution.
Thank you, Madam Chair. It reads, whereas Juneteenth is known as Emancipation Day, is a holiday commemorating the end of slavery in the United States, celebrated annually on each June 19th. And whereas the name Juneteenth references the date of the holiday, combining the words June and 19th. And whereas the significance of the day refers to June 19th, 1865, the date on which the last African-American slaves who were residing in Texas were notified that slavery had been abolished per the signing of the Emancipation Proclamation edict 2 years earlier from President Abraham Lincoln, and who had by that time been succeeded by President Andrew Johnson. And whereas Juneteenth first became an annual celebration in Texas and later throughout the United States, with the earliest observations including prayer meetings, the singing of spirituals, and is grown to include speeches, educational events, family gatherings and picnics, parades, festivals, music, food, and dancing. And whereas it is important to recognize that this date definitely marks the closing of a dark chapter in American history. An ending coincided to the American Civil War, the end of the American Civil War. And whereas in remembrance, Juneteenth is an opportunity for Americans of all races to join together to acknowledge the lasting impacts of slavery and racial injustice in the United States, and to recommit ourselves and our next generation to the goal of dismantling systemic racism and creating an equitable society. Now, therefore, be resolved by the Board of County Commissioners of Douglas County that this board does hereby observe June 19th, 2021 as Juneteenth Emancipation Day, and encourages our residents to take cognition of the day and to participate in its observance. And with that, I would move and ask for a brief comment after the second.
Okay.
I would just like to note that on the 19th, there is going to be a celebration of an event hosted by Freedomtainment. This is the first time that they've done this event here. It's going to be at the Malcolm X birth site. And I'd just like to put that on the radar for the public. It'll be going on all afternoon there with some readings, also some essay contest winners that'll be reading some essays that are relevant to an event that will happen at 11:30 Friday on our courthouse lawn here. If you recall, about 2 years ago, we remembered the horrific event that happened there with Will Brown and his lynching. That was part of the Equal Justice Institute's project. Friday, there will be a marker ceremony there in most of these places to commemorate that marker. Essays will be read at that, and those winners will read this at the Juneteenth event on that Saturday. And also as part of it, there'll be vaccination opportunities and things of that sort. So I just want the public to be aware of that. Thank you, Madam Chair.
Thank you, Commissioner Rogers. Commissioner Kavanaugh?
This resolution gladly, and would like to note the participation of the Douglas County Historical Society in marking this, particularly the Willie Brown lynching and rioting. The Douglas County Historical Society is represented here today by their director, Kathy Alt, and a number of board members. Welcome. Did a great job of hosting and underwriting a historical symposium held here for hundreds and hundreds of local students and the public on the day. Actually, it was 2 days in September of 2019. That symposium of local African-American historians and public figures and organizations was recorded and broadcast by Cox, and I believe the recording was distributed to all the local high schools by the Historical Society. They retain that. If you want to see the best account made of what happened here in 1919, and remember that, that is available to us through the Douglas County Historical Society. So I'm glad that we were able to extend your contract here today. It's a great investment in the history of our community. It's important to remember these things, and it plays directly into this, remembering how race hatred was used in our community 100 years ago to divide us, so that now, learning from that, we can unite as the mosaic of many cultures and ethnic groups in this community to become stronger and freer people. Thank you for your help. The Historical Society plays a key part in this. Thank you very much.
Any other questions or comments?
Larry Storr, 5015 Lafayette Avenue, Omaha, 68132. I'm not against the resolution itself, but I am against some of the language, particularly the last few sentences, as with some other resolutions, and as some of those that we'll be listening to on the 19th. I want to explain why. This is just a portion of the discussion that's out there on the airwaves and in print about a theory that's called critical race theory. I want to caution our leaders that if we want to have a discussion, let's have a discussion, but not a one-way discussion. Now, some of the language in that resolution and others sort of goes along with what the proponents of critical race theory suggest, and it's all white supremacy, against white supremacy. If you want us to be part of the discussion, you got to stop that, because we will not continue to tolerate it. Now, on this Thursday, it's supposedly not in print. They do not explain this. But the Learning Community Council supposedly will be sneaking this through in Omaha. I want the citizens to go attend that meeting and listen to them. Find out what these resolutions they're going to pass on the budget includes, because it's on the radio, even local radio. So it needs to be an open discussion so citizens know what the hell is going on. We are against critical race theory because it's dividing us all. Not because we want to continue systemic racism. If you know who is participating in that, you should charge them with a crime and charge them with a hate crime. This is sort of the reverse of that. Critical race theory is the reverse. So the next thing coming up is reparations, cloaked in the language of certain things. These are not my words. These are other people's words too. I'm not stupid enough to not understand other people's words, but it exists. And I have been at this podium before when certain commissioners have wanted to express a view that you wouldn't allow as a person behind the microphone. They got up here and came down and commented as a commissioner. And they were ruled out of order too. So please, the main thing here is let's temper the language, maybe rephrase the recent resolutions, and then have a major discussion, two-way discussion, not one side only. And I'm going to close with this. Mr. Ben Gray has done a lot of good for Omaha, but he always said we will have that discussion, and he was always talking about race. We have not had that discussion. If you want to honor Ben Gray, let's have that discussion, but with citizens and with more than 3 minutes and without getting cut off or escorted out. Thank you.
Any other comments?
Dan Ash,
I have
Douglas County Clerk.
Sorry, Commissioner Boyle, I'll get to you right after Dan.
Well, I definitely, and it looks like I won't have the last word, so I was going to say I definitely don't deserve to have the last word on something like this, but I definitely wasn't going to let that be the last word about it. I can't remember if I introduced myself or not. Dan Ash, Douglas County Clerk. So I'm not really sure what's wrong with, whereas it is important to recognize that this date definitively marked the closing of a dark chapter in American history, ending coincident to the American Civil War, and whereas in remembrance, Juneteenth is an opportunity for Americans of all races to join together to acknowledge the lasting impact of slavery and racial injustice in the United States, and to recommit ourselves and our next generation to the goal of dismantling systematic racism and creating an equitable society. Wow, how horrible. Shame on you, Commissioner Rogers.
Thank you, Dan. Commissioner Maureen Boyle?
Just a quick comment, basically, to say I agree wholeheartedly with this resolution, as is, and every single word in it. I think that we've gone far too long not acknowledging the contributions of the Black community and of the impact slavery has had on keeping the Black community down. So I think we should at least acknowledge it with an incredible celebration like this, and acknowledge our part in causing some of a big part in causing this problem. So I 100% agree with this resolution. I think everything in it is appropriate and as stated. And anything, I think it's a great, I'm looking forward to the festival this weekend, and I think we should do everything we can to support it.
Thank you, Commissioner. Any other questions or comments?
Luis Jimenez, 3306 Burt Street. Good morning, Commissioners. I want to thank the board for providing this resolution. I don't have any issues either with this resolution. I would have liked to have it in print, but that's my only issue because I didn't get to read it. The City Council did a proclamation on Juneteenth. I think they're on their first regular meeting since the council members were sworn in. So I'm glad to see this on the agenda. I'm gonna get off work early on Saturday so I can attend the Just Ride on at 6 p.m. as part of the festivities. All these organizations and people coming together is amazing. But to the fact that it was on June 19th, after a few years after the proclamation or Emancipation Proclamation, and that it took time for these individuals to know that they weren't slaves anymore in Texas, just shows or speaks to the depravity of what white people were doing to black people during that time. It's wholly racist, and to accept that that's part of the history, I think it's wise for this time and any time moving forward, because it's horrible, the pain and suffering and the missed opportunities that people of color, minorities, and a lot of it was with technology. The white people were more technically advanced. So just looking at this can help us understand where we're coming from and where we're going. I know that leading up to the Civil War, that there was Lawrence, Kansas was sieged by pro-slavery individuals. They came into this town that was in Kansas. They didn't want their activity to include slavery, and they were knocked out because there's, the development of the federal government to encompass the entire continent during this time. And that's encouraging to me, to know that there was people, and that you don't hear that a lot, that during that time there was a lot of people that were against these things that were bad, like slavery and oppression. Seems to me that the people that do the bad stuff get a lot of the attention. But truth be told, I think there was a lot of people during that time that did not support slavery. And that's why there was a war. People were divided. But today, it seems to me that almost everybody supports this. The city council does. The board does. And on June 19th, I think that there's going to be a lot of people that are going to be supporting the ideas and maybe this resolution on June 19th. Thank you.
Anyone else wishing to speak? I'll just say thank you to Commissioner Rogers for bringing the resolution forward. I think it is very important that, again, for historical perspectives, we understand our history and the changes that have been made and are working towards even becoming better. And this is a reminder, at least for me anyway, this resolution reminds me that while we've made good strides, the abolishment of slavery, and again, many things that we've done currently to try to change that systemic racism, this is a resolution that, again, lifts that conversation to the forefront. And so thank you, Commissioner Rogers, for bringing it forward. With that, yep. Thank you. With that, please vote.
I vote yes.
Motion passes 6-0. Commissioner Marine Boyle voting virtually, all other commissioners voting in person.
Our next recognition is going to be laid over, and I'm not quite sure the date, so just lay it over and it will show back up on the agenda when they're ready. Citizen comments. Is there anyone wishing to speak to the board about an item not on the agenda? Seeing none, we will move to presentations. We have just a minute, Karen.
Larry Storr, 5015 Lafayette Avenue, submitting probably the last attachment to my recent comments, but pertinent to today. I won't read it all because I sent you copies. But I do want to say this before I start. I would appreciate if Mr. Ramirez behind me here would identify himself as a community columnist, because he does in fact write a blog which goes into some of the community newspapers. He does sort of equate himself with the organization called Noise, and amongst other things. But I'm formally complaining today, and I'm going to limit it to this for the moment, to the treatment last week. The use of the words, excuse me, which Mr. Boyle used right after I was just walked out. The words bullshit by themselves in the context of what I said about those topics is not really reasonable to call a person out of order for and have them escorted out. So therefore, my main complaint is not to file a lawsuit, but let's have that discussion on the rules and how the rules apply or don't apply through the Open Meetings Act, which an awful lot of citizens are very confused about. It does not imply that anybody has a right, anybody speaking body has a right to order a citizen out if he's not committing a crime. If I've got you riled up so you're fighting each other, yes. If I attack you, yes. If I'm fighting somebody, yes. But not for my words. Mike Boyle stood there after you walked me out or called me out of order and used the word himself. And then him and a community columnist who's also an activist talked about me and the use of that word and me. They were not called out of order. You people seem to make your own rules as you go along. And that goes back quite a ways in the past to where Mr. Kavanaugh and Mr. Boyle were themselves called out of order, not only up there, but also as a citizen of the podium. And one of the repeating themes there is we don't really have any rules. Whose rules? Parliamentary rules? Rules, Robert's rules of order? Which one is really most recognized? Or are we recognizing other bodies' rules for how to limit citizen comment? Because it sure looks that way. And don't call me a liar, because it does get in the World Herald that certain bodies are trying to limit citizen comments. And then they finally quiet down because the public is raising their ire. Well, just wait until the public gets word that Omaha is going to sneak through some things through the Early Buffett's Learning Center that are probably critical race theory, and they're not telling us that. Mike Boyle says you cannot say the word revolution in this chambers. Yes, I can. Very easy to say it. But when those kinds of theories are spreading nationwide, my own granddaughter
1 minute.
in Virginia Beach is experiencing it. She's a teacher. Loudoun County in Florida. They're not the only state. So listen up, pay attention, and then have a discussion about what is American and what is not American. Marxism or Black Lives Matters involves, and they admit to being Marxist trained. We need to have that discussion so people understand what Marxism is. And under Marxism, No lives matter. No lives matter, whether you're white, black, pink, purple. Thank you. They killed many people.
Next is presentations. The COVID update and COVID vaccination plan update presented by Dr. Adi Poor. Good morning, Dr. Poor.
Good morning, board members. And I want to report to you just a few numbers today. Our 7-day rolling average is 2 cases per 100,000 or 11.3 cases per day in Douglas County. And I just got the report 2 minutes ago. Yesterday, we had 16 new cases reported and 221 tests done. What we are seeing is, I reported to you over the last several weeks that we have seen constant decreases in cases. Now, this week, I need to report to you that we are flat. We had 88 cases this week and 86 cases the week before. So it seems to a certain degree we are at this endemic level, so to say. And we are seeing also a decrease in our testing that is being done, and therefore the positivity rate this week is 2%. It was 1.5% last time when I talked to you. What is interesting this week is from these cases, we suddenly are seeing 11.4% of the cases are in the 15 to 17 years old. We have never seen that. Usually they make up potentially 5% of the total cases in a week. So we definitely have seen an increase. The numbers are not huge, but it is 10 cases of those 88 that we had last week. And I had staff go back and try to look at it. What can we find out when we do investigations of these 10 cases? They came back and they said there is no connection between these 10 cases. Some of them are exposure to a positive case. Some of them are travelers. But what all 10 have in common is all 10 are non-vaccinated. And so I really think that is the message that we probably want to get out. Hospitalizations, we have there too. We have kind of reached this low 20s, 22 hospitalizations as of last night, 6 of them in the adult ICU and 5 on ventilators. It also has an effect, the hospitalizations have an effect on our dial. I don't know how many of you are still looking at our dial, but our dial is still at the lowest level in yellow. It's not in the green yet, and it has to do with the numbers we have in the hospital. We have 729 total deaths, none of them in June yet. Just a little bit on the variant that you may be interested. So Nebraska Public Health Lab has sequenced 1,003 specimens, and 800 of them are variants. And of course, the most common one is what is called now the Alpha variant or the UK variant, 717 of them. 4 of them are South African, 14 of them are Brazilian. But I think what you are most interested in, or what I'm interested in, is that 0 are the Indian or the Delta variant at this time. And that's really what we want to keep it at. Let me talk about vaccination. We have administered more than 610,000 doses of vaccine in Douglas County, 524,396 of them to Douglas County residents. But at this time, you know, you can get a vaccine if you come and travel from someplace else. It doesn't matter anymore. 284,544 residents have received 1 dose. 257,853 are fully vaccinated. This is from all the Douglas County residents. That is 46.5%. I hope before I retire, we are at 50%. I would love to retire saying 50% of Douglas County residents are fully vaccinated. The other goal, of course, is the goal that I shared with you before. It is that 70% of adults, those 18 and above, have received at least one dose by July 4th. Would be very nice too if we would achieve that. We are at this time at 65.1% of adults who have received at least one dose. When we look at the age ranges, which age range has made the most progress? I'm really happy to say those 16 to 19 years of age. 48.8% of those youngsters have received at least one dose. And from a week before, we have seen a 1.3% increase. That's great news. When we look at race and ethnicity, we still are seeing a difference between the races. But what is interesting is that the Hispanic population has seen the highest increase. They are at 39.4. And who has seen the lowest increase? It's white Caucasians. So we have 52.8% of the Asians who are eligible have been vaccinated with one dose, 50.5% of the whites, Native Americans 42.4, Hispanics 39.4, and African Americans 31.0. That also tells you why we really, now that we are moving into these mobile pop-up clinics, we are really focusing on North Omaha and South Omaha. So we were at the Cinco de Mayo last weekend. We didn't have a perfect spot, and so I'm not so sure, if that had anything to do with our vaccines, but every single vaccine is for me, a success. And it tells us to the community knows we are there and we are caring for them. This week, we are going to all the libraries. We are going to the zoo again tomorrow. We were at the zoo last Wednesday, and even so, some of you may say, well, why are you going there? It was very interesting what our staff experienced, that there were individuals who did not go visit the zoo, but they heard that we were there, and they just came for the vaccine. So you always are catching that one or two person who just hasn't had an opportunity to get vaccinated yet. We are going to be at Taste of North Omaha Friday, Saturday. We are going to be at Juneteenth. We are at the college. We are going to be at the College World Series and the swim trial. They are kind of in the middle, starting tomorrow or even potentially today already. A lot of the community clinics, I think I have shared with you before, they are planning to close down because some of them, especially CHI, they are moving all into their family practice clinics. So CHI is closing on June 17th. Methodist is closing on June 26th. They have submitted all their paperwork to the state to get an application in so they can provide vaccine at their primary care clinics. Nebraska Medicine has the last clinic on July 18th, and Douglas County at 35th and L, I think we are closing our clinic on July 8th. It just seems to be more effective when we go out into the community. We still have, as a standing clinic, every Friday, we have a walk-in clinic at our Douglas County Health Department here. And we have about 100 people last Friday. It was crowded here. So people are starting to get to know it, and it's word of mouth. But anybody can walk in. We have all the vaccines available so people can have choices. We are finding out now too that even on the pop-up clinic, we need to have at least 2 of the vaccine, the J&J and one of the mRNA, either the Pfizer or the Moderna available. We are still doing homebound and potentially close to about 10 homebound visits a week. Most of those are to individuals who want Pfizer, so we need to go back to them after 3 days. The other thing I just wanted to share with you, Our information line has received now in this year more than 57,000 calls, 2,400 of them in Spanish. And we have distributed 12.6 million pieces of PPE in Douglas County to all our healthcare providers and community organizations who needed it. Just some updates that I heard today from at our 9 o'clock call. Clinical vaccine trials. We are hearing that the Pfizer vaccine from 2 to 11-year-old, it's going to be for it's going to go for EUA in September this year, and we are hearing that Moderna, 12 to 17, which is the same age range that the Pfizer vaccine is in EUA right now. We are also hearing that there are going to be of course, a lot of other studies going on with the younger age group. We are hearing Novavax is also going to go in and do a trial 12 to 17, and Janssen & Janssen has nothing actively at this time. They also emphasized that these were physicians, pediatricians, mainly from Children's Hospital, who really emphasized again that the American Association of Pediatrics is encouraging parents to have children above 12 years of age vaccinated, and also that the AAP is recommending vaccination of COVID co-administered with other immunizations that children may need. The other thing is that a word that one of the pediatricians closed with, saying that the risk of COVID outweighs any potential risk from the vaccine. And that has mainly to do with some of the reports that you have heard in regards to myocarditis and pericarditis that have been seen in children and are being really evaluated very closely at this time. We are hearing that CDC is going to meet on this and is reviewing these reports, is going to come forward with some report at the end of this week. So that's kind of all I have to share with you this morning. I'm more than happy to answer any questions that you may have.
Thank you, Dr. Poor. Commissioner Kavanaugh?
Thank you. And thanks for this. I'm glad to see that you're getting out to the community, and I was pleased to see that the visitors improvement sites that we forwarded to you, among them Cinco de Mayo, or among the places that you're going. I was at swim trials yesterday. I don't know if you're doing Olympic swim trials, but there's a big crowd there. It strikes me that your tactic, which is effective, is the one that somebody asked a bank robber once, why do you keep robbing banks? And he said, well, that's where the money is. And why do you keep going to these sites? Well, that's where the people are. And you're doing a good job of that. I think the swim trials run another day or so, and if you can get a pop-up there, that would be great. There's people from all over the country at those, and that would be a good opportunity. I was trying to write as you spoke about the ethnic breakout relative to vaccines. Could you give us that again real quick, please?
Absolutely. So Asian, 52.8%, whites, 50.5%, Native Americans, 42.4%, Hispanics, 39.4%, and blacks, 31%.
Thank you. You know, it's funny because we talk about these disparities. We just had a corrections report where it's exactly the opposite, where we have our people of color overrepresented in the correctional place. But in this, we have the exact opposite of that. And I'm glad to see that you're reaching out to those communities within Douglas County to try to bring those numbers up. Thanks for that. It looks like we're at, according to the dashboard, I think you said 46% total population vaccinated. Is that right?
Yes, 46.5%. Don't underestimate. We need to have
exactly. I don't want to short it. 46.5%, and I sincerely hope we get to 50 before you leave. That's of the latest number that I saw, 72,017 positive cases in Douglas County, people who've contracted COVID. And of those, 729 have died. And so, you know, it's very, very important. This is a huge number of deaths in 1 year. You know, it beggars anything that we see in terms of any other cause of death, I think. And you make a great point that the continuing deaths that we see are people who aren't vaccinated. So, you know, your choices are getting really clear and stark. You can get vaccinated, or you can get sick and potentially die. Those are your choices. And it's really irresponsible not to get vaccinated. It's irresponsible for yourself, but for the wider community, not to be vaccinated is an irresponsible course. So thanks for all the education that you've done, the millions of pieces of information that you've put out there. And I think that we're moving in the right direction. One last thing, this goes to the last real population that we haven't gotten to, which I think are either under 15 or under 12 children, younger children. What does it look like in terms of that population receiving vaccinations, if you know?
So I do know, Commissioner, we have 7.1% of those 15 years and younger that have received one dose of vaccine. It's going slow, but it's—
1 minute.
Oh, go ahead.
I just said 1 minute, Dr. Poor.
Okay, 7.1%.
Under 15.
Under 15, yep.
And does that go down to, like 1 year old or,
That would, and some of them actually are at lower age. They have been children who have been enrolled in trials, and they have opened those trials up. So individuals who have been vaccinated in that younger age, they are also in that 7.1, but that's very few numbers.
Sure. Well, thank you, and thanks for all your good work.
Any other questions or comments for Dr. Poor? Again, thank you for being with us this morning, Dr. Poor.
I have a question.
Oh, yes, sorry, Commissioner Boyle. I didn't have the pictures back on, so I didn't see you, sorry.
Oh, got it, no problem. Just a few questions. One is, you mentioned that the younger population are the ones that seem to be more affected at this point. What's the morbidity? What symptoms are they showing up with, and are they hospitalized?
So that is a good question, and I actually am able to answer that. Their symptoms are very similar to what the adults are seeing. I don't know what to do with it right now. Let me look at it. But the primary symptoms that individuals have after so the question, I guess I need to rephrase it. The question you are asking, what are they showing up when they are being hospitalized? And individuals are saying there are not enough patients who they can show it to. However, the other question that could be answered is, what do children experience after they have been vaccinated? And they have done some studies, and they show the primary symptoms are dizziness and fatigue. Those are the two symptoms that they're seeing in individuals. But in regards to the question was, what they are seeing right now, I think, at Children's Hospital, 3 individuals with multi-symptom disease. So that's what they are concerned about at this time.
Yeah, I think early on there was concern that kids who got COVID had this really strange multi-system issue that they couldn't put their finger on, and it looked so different in adults. It was hard to pinpoint. It was less respiratory and more multi-organ system. So I didn't know if that's how these kids were still presenting. And if the hospitalization rate was anything like what we were seeing with adults, and whether they were ventilated. But from what I read, I don't think that's the case. I didn't know if that's what we're seeing locally.
I don't think that is the case locally, neither, Commissioner.
Good, good. And then as for the pop-up vaccination sites, it sounds like it's a great idea, first of all, and I'm hugely in favor of it. Can you give us an idea about what the numbers are for how many vaccinations are given, say, per week with those pop-ups?
Not so much per week yet. I can tell you, I just looked at it. I wanted to see how are our vaccination rates looking. They don't look like they are bottomed out. So on the 10th, 1,939. On the 11th, 1,256. Yesterday, 532. But we need to consider, these are pharmacies. Everybody's doing vaccinations at this time. On our pop-up sites, I think Cinco de Mayo was less than 20. I think Heartland Family Services yesterday was less than 22. So we are usually there for 3 to 4 hours. And, if we get 20, I think that's a win for me. We are also going to go back to the schools because superintendents, especially in principals, they are concerned. They want to make sure that their children have the opportunity to get vaccinated so there isn't so much disruption of school when they start, because they potentially won't have the option anymore to learn from home. So if they have to go in quarantine or isolation, they'll be out of school. So we'll do that this week too.
Good. And then the other thing too is you had mentioned something about home. I was wondering if there's a relationship with, say, home health or with VNA about getting those folks who are homebound, getting them vaccinated. You alluded to that.
1 minute.
Is that, yeah, so I'm just curious if you could just speak to that a little bit more.
Yes, we do. So people who are homebound, who cannot go to see the physician, they call in 444-3400. And then we have a schedule that we set up. We have 2 nurses who then go out and vaccinate, but we are also using VNA and MAPS at this time for that. So that has been very beneficial for us, and I think our community appreciates that.
Very good. Thank you very much, Dr. Poor. I appreciate everything you've done to help get us through this.
Commissioner Borgeson, can I just say one more thing? On this morning's call, an emergency doc was saying that he has a patient again, potentially has a COVID patient potentially dying from COVID, laying on his deathbed and says to the physician, the only thing I wish I would have been vaccinated.
Yeah.
So that's my message for today.
Dr. Poor, in terms of the older population and the homebound or in-home, I also wonder if we should reach out to the senior centers if we haven't already done that. I think that it might be worth even putting in a little bit, if we have a message card about the vaccinations that can go in the home delivered meals packet, that would be great too. So that would be, again, coordinated through the Office on Aging, but has there been reach out with those individuals?
Commissioner, we are in touch with them all the time.
Okay, good.
And what is interesting is that we have such good vaccination in the elderly.
Right.
And I can just share with you, when I look at the cases last week, we had 4 cases 70 years and older. So you really see, and when you look at it, 85 age and above, 75, between 75 and 84 years of age, 97.5% have at least received 1 dose.
Wow, that's excellent. That's excellent. Okay, great. Thank you. Luis?
Luis Jimenez, 3306 Bird Street. I have a few questions, mainly. Is the health director have a retirement date coming up? Does the health director? If so, what is that? I read on the news that the Dr. Adipur was going to retire.
That's true, Luis.
Can I answer that, Commissioner?
Sure.
So yes, I do have a retirement date, and it was June 30th. However, because the new director is coming in on the 7th, so I'm going to stay through the 6th of July.
Thank you for that. Congratulations on your service to the county as public health director. Also, I know that a lot of people are trusting the doctors at UNMC, and I heard Dr. Khan from, well, he's an epidemiologist or something like that. He said that a few months ago, he said that he expected the pandemic to last until the fall, like it's September. I heard at corrections and then also hear about numbers bottoming where there's an increase or a high rate. I heard that about 2 months ago, there wasn't any cases in the corrections. And that's amazing because during the pandemic, jails, tight quarters were a hotspot for infection. And then now here we have numbers that indicate here anyway, locally, that's not going to be a pandemic. I don't know if you have to look at the numbers again and say this here is not pandemic. Is the fall, is that a time period where you anticipate that you might look at the hospitals and say, you know, this is a very low occurrence for the virus? Well, if you can't answer my question, I understand, because that's more of a prediction from the doctor. I want to also say that I've been tracking the numbers, especially from Dr. Poor, and I share them with the community, like the rates of infection, vaccination, all these things. If that makes me a columnist, so be it. I'll show you the last thing up here that I shared about the pandemic. Can you put it up, please? Last time I reported on the doctors provided by Dr. Poor, 23% were fully vaccinated in Douglas County. That was on March 30th. So today I hear that possibly we'll get that 50% vaccinated by July, and I hope that happens as well. Thank you.
Thank you. Any other questions or comments?
Larry Storr, 5015 Lafayette Avenue, 68132. Thank you, Dr. Poor. I do have a question about the rules of debate and everything. You have new rules setting out front that say
Can you keep
something
to the
about
topic,
presentations,
please?
excuse me, presentations, items from the public. Was this a presentation from the public or a presentation invited by Dr. Poor?
Larry, it's an
And
agenda
are we allowed
item.
to ask questions
Yes,
during
you're at the
this type of
podium.
presentation?
Yes, you're at the podium.
All right. I didn't see anywhere in the rules where it said that we could do that.
Any other questions or comments? All right, again, thank you, Dr. Poor, for being with us. We'll move to public hearings. We have one. The public hearing is for Judith Batten. She's the applicant for a farmstead lot split, preliminary and final plat of proposed lot. And with us today is Dave Forrest from our Planning and Zoning Commission, coordinator, sorry. and he will give us the specifics. And the
Morning.
public hearing is open. Good morning.
Good morning, Commissioners. Again, Dave Forrest, Planning and Zoning Coordinator for Douglas County. We have two related hearings, both as you, I'm sorry, Dave Forrest, Planning and Zoning Coordinator. Is that better? No, that's okay. I'm probably too tall for the mic, I guess.
Maybe push both of them together.
Okay.
It might help a
All
little
right.
bit.
Maybe a third mic, too. So we have two related hearings, both regarding a minor subdivision of approximately 26 acres that will result in about 3 acres of residential and 23 acres of agricultural land. This is a fairly routine subdivision. It's been before the Planning Commission. It was approved. The county engineer approved it, and it's on your agenda for approval today.
All
And
right.
I have the applicant in the audience in case there's any questions.
Okay. Are there any questions during the public hearing, those for or against this first item? Seeing none, I will close the public hearing. What's the will of the board? Motion by Commissioner Rogers, seconded by Commissioner Friend. Please vote.
I vote yes.
I'm not sure why that's not showing on the, oh, here we go. Okay. Thank you for bearing with me. Motion passes 6-0. Commissioner Marine Boyle voting virtually, all other commissioners voting in person.
Next public hearing will be, I'll be opening as item B. Again, this is applicant Judith Batten, and she's requesting rezoning from ag to rural residential on the proposed lot. And Dave Forrest is here again to give us the specifics.
This is
Madam, sorry, Mr. Forrest. Public hearing's open, Madam Chair.
I said that,
Oh,
yeah.
I'm sorry. Thank you.
Yep.
This subdivision is known as a farmstead lot split, and part of that process is that the remaining part of the agricultural parcel that has the residence on it is rezoned residential, and the remainder is agricultural. So the second step in the process is that we rezone the residential piece to residential, and that's what's on your agenda.
Any questions or comments? For or against? I will close the public hearing. What's the will of the board? Motion by Commissioner Friend, seconded by Commissioner Rogers. Please vote.
I vote yes.
Motion passes 6-0. Commissioner Marine Boyle voting virtually, other commissioners voting in person.
Thank you, and
Thank
thank you for being with us today. Next, we'll move to committees. First is the finance, just the budget report as presented. We do have one item under community services. It's a reallocation of the 2021 Visitors Improvement Fund Award for Blue Society of Omaha. Is there a motion to approve? Is there a second? Motion by Commissioner Rogers, seconded by Commissioner Friend. Any questions or comments? Please vote.
I vote yes.
Commissioner Borgeson.
It didn't take, there we go.
Motion passes 6-0. Commissioner Marine Boyle voting virtually, other commissioners voting in person.
Next is the Human Resources, our weekly personnel report from the Civil Service as presented, unless there's questions or comments. No legislative items at this time. We do have need for an executive session for litigation purposes. Is there a motion to go into executive session? Motion by Commissioner Morgan, seconded by Commissioner Friend. Please vote.
I vote yes.
Motion passes 6-0. Commissioner Marine Boyle voting virtually, other commissioners voting in person.
Recording stopped.